So I'm going to mute myself now, Wendy, and I'd like to hand over to you.
Yeah, okay, thank you. Well, I'm Wendy Edwards. I work for Halton Sensory Services, and that is a partnership with ourselves, Deafness Resource Centre, and Vision Support, and Palm Borough Council as in the team as well. And we've now got a base in Widnes. We're right opposite the post office and John Geddes Cycles. And ideally, we just started to get people coming through the door. And of course, we all know what happened then. But basically, the service is the two of us. And just to make clear, ourselves at top, we're not audiologists. We don't actually deal with the hearing aids themselves. We deal with equipment that aids the hearing aid, if you like. So some people get a bit confused that we're actually audiologists, but we're not. So basically what the service, anyone can refer. So it hasn't got to be a GP or a medical person. So if you're aware of somebody that's struggling with the hearing loss or the sight loss, and as long as you have the permission of the person, that's all we ask, is that the permission of the person is given, anyone can refer into us. So they will contact, I will give you the number at the end. So they contact us by email, by phone, usually obviously you could drop in, and then we would go and visit. Either we can visit the person and do an assessment at the home. Obviously we haven't been doing that, we've been doing all kinds of video calls and through windows and all kinds at the moment, but now people are saying, obviously we've got full PPE. I've had both vaccines. We get tested every week, so we are able now to go back into the homes, and people can come here by appointment, which is great. So we are getting back to some kind of normality. So my role basically is if people are having issues around the home. So for example, one of the main issues is the television. Radio can be on too loud, especially if you've got more than one person. So the person with the hearing loss has it loud, the other person is saying, I can't stand this, especially with the recent times. They're at home a lot, watching a lot more television, and it's just become a real issue. So we can provide equipment. Is anyone familiar with a loop system? Yeah, it's basically a system that works with the hearing aid. People don't have to have a hearing aid to be referred to us. If they don't have a hearing aid for whatever reason, or they haven't yet had the appointment to get a hearing aid, then we can use headphones. So it doesn't matter that they haven't got a hearing aid. And there's equipment that we can set up near the television, and basically the person watching the television, the other person in the room can have the television at their level, so it's not too loud. And instead of the person with the hearing loss turning the actual television up, they will turn the equipment up. So it comes louder to them in the hearing aid or the headphones, but not to the other person. So both people can watch at their own level. Also, it's not so much loudness, because people with a hearing loss, sometimes you can put something louder and louder, but there's actually no benefit because it becomes distorted. So the idea as well is that the headphones or the loop can give you more clarity. So it's clearer rather than just louder all the time. Because it's a fallacy, people think, oh, talk to somebody with a hearing loss, just talk really loud. And it's actually not always the right thing to do, because it can distort the lip pattern, and it can make it harder for people to understand what people are saying. So, so that's one issue, which is a lot of calls we get. The other issue, of course, is the doorbell. Again, especially with the recent times we've had, people have been getting things delivered, shopping, the chemist, the prescriptions, and people have missed the doorbell. So we can provide flashing light doorbells, so they can have a bell that flashes and rings loudly. That can also be connected, if need be, to the telephone, because again, isolations, even before COVID came along, isolation for people with hearing loss and sight loss is huge. So they can have a light connected to the same system, but it will ring loudly and flash when the phone goes as well, so they're aware that somebody's ringing. A real problem with people with hearing loss is the hearing on the phone, the conversation. So again, we can have on the landline phones, we can either people take phones out with amplifiers built into them, or we can add on an amplifier to an existing phone to allow people to hear better on the telephone. A lot of people have mobiles now. There's not an awful lot because we don't tend to go into mobiles because there's just so many on the market. But again, we can just advise people, with the loop system, there's like a neck loop that people can have that they can put into the phone so they can hear the phone call through the hearing aid. So there's lots of different things we can try to help them with the phone calls. And then the other one, safety, is smoke alarms. So of course, if somebody has they say, yeah, I've got my hearing aids in, I can hear the smoke alarm in the day, not a problem. So we say, what about at night? You take your hearing aids out, you're fast asleep in bed, and the amount of people say, oh, never thought of that, especially if they live alone, it could be a real safety issue. So we have connection with the fire service. So we would refer them to the fire service, and the fire service would then come and do an individual assessment. And then if they felt necessary, they can provide a smoke alarm, but would have a vibrating pad that goes under the pillow and a flashing light at the side of the bed. So obviously they would ensure that they will be aware of smoke alarm as well. So that's through them. Also, young mums or mums that have a hearing loss, people tend to forget how they're going to know the baby's crying. Again, baby alarms with the vibrating pads that would go. So obviously in the day, we can have an alarm that has a light that, obviously like normal baby alarms, that lights up, but at night time we can add the vibrating pad to alert them at night time as well. Because we had a situation last year where some mums weren't allowed out of the hospital because they said, how am I going to hear my baby cry? And it's calls like this that we need, because the service has been around for years and years and years, and we had midwives, district nurses that didn't know to contact us to be able to provide that piece of equipment for those mums. So hopefully that shouldn't happen again now. So we've got that situation as well. Alarm clocks, again, younger people, because we do right from birth right through to the older people, so it's right across the board. So we've got young children that initially, they didn't need to answer the doorbell because they were too young. Mum and dad got them up for school, but obviously as they progress to teenagers, they want their independence, need a little bit more independence, maybe going to college. So again, we have alarm clocks, exactly the same thing, vibrating pad under the pillow, so they can actually alert them to waking up, and they just have their independence, which is how it should be. Obviously, a lot of the younger ones now, they have all the phones and all these technology. A lot of technology now lends itself to people with hearing loss because we have emails and things like that, but there is still people that want the traditional equipment, like the proper alarm clocks and things to waken them. So we've got that situation as well. Another massive thing for people is conversation, especially people if they're maybe in a care home, or again at the moment when we were so isolated, if people had a bubble and they had people that could go in but they just couldn't hear the conversation, or so we have a personal listener, which again can be used through a loop system with the hearing aid or headphones. So you'd have a small unit about the size of your hand with a microphone in and a volume control on. So somebody can sit comfortably in the chair and have a nice, especially again with face masks. Obviously for people with a hearing loss, face masks have been an absolute nightmare, can't lip read. So with the microphone, even with a mask on, people have had that opportunity to be able to hear people's conversation a lot better, especially again in care homes, people, and it's a lot of it, we've had a lot of people with maybe got dementia, so people are shouting at them, and of course thinking, why is somebody shouting? They can't understand why somebody's shouting at them, but to enable them to hear. Whereas with the equipment, they can sit back comfortably in a chair and just have a nice easy conversation rather than everyone shouting at everybody. So again, that's been really important with the current situation, and in care homes and things like that for the staff. So all the equipment is part of an assessment. It's free of charge. We do ask, because we're a charity, for the assessments, if people are able to, we maybe ask for a donation, £10 or £20 for a donation for the initial assessment, if they're able to. After that, the equipment itself is free of charge. And then if there's any problems with the equipment afterwards, that they're not working, then we would go back out and either replace it for new or obviously fix the problem with the equipment. So once they've got the equipment, it's on long-term loan, it's theirs as long as they need to use it. And obviously we're always here for any help or addition. So that's the equipment side. Again, with Vision Support, they contact, and there's a sort of equipment side with magnifiers, glasses, cane training and things like that. The other side is Vision Support, which the ladies are more, they will have more of a long-term role with them. So obviously things like people being able to read the mail, you know, they've got people that can't read their mail, so they will go maybe every other week, do the shopping, take them shopping, if they need to be guided with the shopping. So theirs is more of a long-term relationship, if you like, whereas the hearing, we tend to go in, solve the situation, and then we're just here if they need us. Sorry, I'll just go and shut my door. Sorry, it's a bit of noise. Sorry, my door came open then, I was conscious of some noise. So that's, again, with the vision side. Both of our services, we also have, which again, haven't been able to go ahead, but the support groups. So again, a lot of it is isolation. We have a hard of hearing group, which we just started a new one before the lockdown, which was proved really popular. And we have now got a bit of a waiting list because, again, people have been isolated, and they say just being able to talk to somebody that has the same situation. So I mean, I haven't got hearing loss, but families can be sympathetic to a degree, but they don't actually really know what people are going through with this hearing loss. So they said just coming together and saying to somebody, oh, I have that problem as well. And, oh, have you tried this? And give each other tips and things like that is invaluable. So we are intending as soon as we can to resume those support groups face to face. We also have a tinnitus support group. Tinnitus can be very much related with hearing loss, but we also have people who just have tinnitus who don't have a hearing loss. And again, the influx of people through the pandemic with tinnitus has been unbelievable. And we have managed to keep that going, that group on calls like this, like Zoom calls. And I've had quite a few new people, but again, we are wanting to resume that face-to-face, both in Halton and Widnes. So both groups, we'll have a group in Halton, a group in Widnes, for people, and possibly still continue the Zoom calls for some people who maybe are at work and can't get to the face-to-face ones during the day. So there's all that involved as well, and general information. If people don't necessarily want an assessment or equipment, we've had people just saying, I just need this piece of information, or what do I do about this? And we can advise them. I say we're not audiologists, but we work closely with audiology. So if people are having issues, how do we go about getting a hearing aid? We can advise them on that. So, and I say they don't necessarily have to have, if somebody said, I think, you know, I've got a hearing loss, but I haven't actually got a hearing aid, we won't say, well, you have to have one. We will see them in the interim and say, right, until you get a hearing aid, we've got headphones that you can use, and then sort your hearing aid out at a later date. So we've got that. We have a deafness resource as well. We have deaf awareness training for people and groups, because again, a lot of we have all the equipment, which is great, but a lot of times the biggest help for people with hearing loss is other people taking that time just to say, you know, speak clearly and be aware that they have the hearing loss. And there's lots of little tips that you can do just to help the people without any equipment. So we have all that information as well. We'll take families, we do young families as well, family groups. So we have a lot of people that children, either the children are deaf and the parents are hearing, or the parents are deaf and the child is hearing. So we'll do family sign sessions to make sure that there's no lack of communication between families, We've got a team that will do family sign sessions to ensure that, you know, there's no child or parents that can't communicate with each other. So there's lots of different sides to it. So basically what we say is, there's anybody with a hearing, sight loss, and anything that I've just talked about, you think, well, she didn't cover that, but get them to contact us, because if, you know, there's lots of things we can help with. If we don't know, we know people that we can pass people on to. So anything at all, if anyone's worried, they're not sure where to go to about hearing loss or sight loss, they can contact ourselves, and we've got teams all over that we can put them in touch with. So that's basically, I'm conscious I'm going on, I don't want to go over my time, so but that's basically who we are, what we do, and we're just conscious that we wanted calls like this, because the amount of people that I'm going out to that have maybe had a hearing aid 5 or 6 years and they still don't know that the service is available. They've struggled on. Some of them don't even know about the loop system, and it's just criminal because they've put the loop on, had a piece of equipment, and they get the wow factor. You know, wow, I didn't, and just for the fact that they didn't know it was there. And it's just, well, for me, it's so frustrating that people, so it's brilliant that we can have these conversations, because you might say, well, I haven't got hearing loss, or I haven't got a sight loss, but I can assure you in the next week or so, you'll bypass somebody, or you'll know somebody who knows somebody that has. And if you can just say, well, oh, do you know what was that lady going on about with that number? And oh, here's a number. If you can just pass that number on to somebody, that's invaluable to them and us as well. So that's why we want to just get across the board to say to people, even if it's not for yourself, have the number and know about us, so you can pass that information on. And that's, you know, we're in contact as well, because people now have spec savers. If people can't get to the hospital, people struggling to get to the hospitals to get the hearing aid seen to, or get a hearing test, they can now refer to spec savers, which means people are local. And also, just again for your information, if it's for an actual hearing aid, they do have to go through their GP. So if they want a hearing test and a hearing aid, they do have to get a referral from the GPs. If it's just for equipment, or they've already got a hearing aid, or they just want some information, then they can come direct to us, and can be referred from anybody, as long as they have the permission of the person, they can just refer direct to us. So that's it. So I've more or less covered everything. I say, once we can, we will just be again a drop-in office, that we want to encourage people to feel as they're passing, so I'll just drop in and ask that question. At the moment, it is by appointment. Also, we have, if by appointment they can come here, things like the telephone. We can't actually supply telephones because of the same cost as you or I buying a phone. But what we have is we have a display of equipment. So what people can do, if eventually, is come in, try the phones out. And so if they do have to buy one, at least they know it's going to work before they pay out for one. So they can just come in, try the phones, find one that suits them, and then we can give them the information of where to get them from. So that's another side of it as well. So I think I've covered everything. I've tried to. So if anyone's got any questions in particular, and I say I can give you the information, the phone number and everything. And if anyone has anywhere that they think we can drop leaflets off, I know leaflets at the moment because of COVID people aren't allowing, or if you've got email addresses, my colleague Lynn can send out the information on email that you can pass on to anybody that you know it may be of interest to. So if anyone's got any questions, want to ask.
I just wanted to say, Wendy, thank you so much. That was a really informative talk.
Oh, good.
I've learned so much from it. I mean, things I took for granted. I didn't understand the smoke alarms and things, you know, about the baby alarms. They were things that I would never have thought of. Yeah. So that's added information for me. And I'm sorry, I'm consciously take off somebody else's questions. So I just wanted to say thank you very much.
No, you're welcome.
So we'll go over to questions. Anybody else have a question?
Diane's got a hand up, I can see.
Yes, hi. Yes, very informative. Hi.
Oh, good. Hi.
Two questions I want to ask.
Yeah.
You mentioned about the masks giving great difficulty for people.
Yeah.
I saw on television the other night somebody interviewing somebody, and they had a mask with like a clear piece in the middle. Do you know where they can be supplied?
Well, I have those. I actually have one of those. I'll just see if I can find one. Yeah, that's what, I don't know if you can see, but that's what I wear. So you put it on like that.
Yes,
now we had to get them.
That on.
Yes, I mean, some people wear the visor because obviously you've got the clear visors, but there was a bit of a discrepancy as to how effective they were. They were actually somebody in Liverpool, a lady in Liverpool that was connected with the Liverpool Deaf Society, that she made those that we got, and she's on Facebook. So that's what we had to do, just because we thought, well, we can't be seen, we can't be going out to people and we're not being able to. But I mean, they're better than the others. I mean, they can still steam up and they're not ideal, but they are a help, rather than having nothing. Yes.
I didn't know if there wasn't like an official supplier of them for people who
sadly not. No, I mean, there should be, but but we've had them okay that we can wear those. But yeah, it's on Facebook, which is, I mean, if anybody's interested, I can get the information of and pass it on if anybody needs that, certainly. Yes. Yeah.
And the other question was, you said at the start you're working with Halton Borough Council, etc.
Yeah.
To sort of, something was raised with me a couple of weeks ago. It was regarding support for children in school who are deaf, and there seems to have been a drop-off in the support given to them. They don't have the same teaching assistants with them and support workers with them. Have you been told about this?
I haven't. Well, no, I mean, everyone, I mean, that's part of one of our ladies. She works with families, Jo, from Deafness Resource Centre, and she covers all of Halton, St Helens and Knowsley. But they do have teachers of the deaf. Now, I know there's been issues with funding and as always and things like that. Yeah. But if there is any issues, I would imagine she would know about it. Or if she doesn't, then we can, again, any situation like that you know of, that would be our St Helens number, because that's the lady who works from our St Helens number at Deafness Resource Centre, to contact them and see if there's anything that they can help with. For sure, she would want to know about it and see if there's any way that they could help regarding that.
It does seem to be a funding issue at the moment, that the support for deaf children in school in Halton seems to be going down.
Yeah. But we have got a team that's their specific role. So if there was any issues, by all means, I can give you both numbers. I'll give you the St Helens number as well. That would be brilliant. For anything like that, for the teams, contact them and ask for the families team. Definitely, yes. Yeah.
Thank you. Thank you very much.
You're welcome. Okay.
We have Paul hand up as well, I can see.
Hi, Paul.
Hi, Wendy. Thanks very much. I'm just trying to find the unmute button. Thanks for the talk. Really a lot of information, very useful. It's just a quick thing. Have you got a shop or centre in Runcorn, in the Runcorn area?
We haven't, unfortunately. We've just got the one in Widnes, but we do cover, obviously, Widnes, Runcorn. But I'm over in Runcorn, quite often. So if anybody couldn't get to here, then obviously they would contact us, and we would happily go over to them there. Obviously, also the support groups we are doing in both areas, so we will have something over there. But there's also, I know we're trying to get in with, and we've noticed in the shopping city, they're having like a hub. So we're very keen, obviously, now we can a bit more. We want to try and get into there, that we would ideally say to them, right, when you've got your sessions, we could pick a day and we can just be on hand, that as people go into the hub and say, oh, definitely, Halton Sensory here, if you've got any issues. So we are aware of that starting, and we want to try and get involved in that. So we do have a presence over in Runcorn as well, because I am aware of the Widnes Runcorn, that we need to try and make sure we are accessible to both people. So yes, we're going to try and get in contact with somebody, so we will have some kind of sessions over there as well.
That's great. I just wondered about the hub in the shopping centre, because they're trying to get as many services in the hub, so I think you should be there.
Yeah, well, definitely. So we just need, if anyone, a contact on there would be great, because we really need to get over there, because now we can start sort of being out and about a bit more. You know, things are opening up, aren't they? So we're hoping that we can have more of a presence. Yeah.
Okay.
Wendy,
Wendy,
we should be able to put you in touch with somebody at the hub.
Perfect.
I think they said they were due to start properly in September.
Right.
Still doing.
Right, okay.
We've got another presentation coming up from Carl Mackey, who gave us a talk about it a month or two ago. But yeah, I'll dig out the details.
Oh, that'd
get
be
them over
perfect.
to you on that.
Could email it to me, that would be great.
Just ask, how has access to services been under COVID? Have there been difficulties? I mean, we're looking at GP access at the moment.
Right.
And also dentistry, but have you noticed have you got any more feedback over how, whether it's been better or worse trying to contact services and access them?
We haven't, I haven't necessarily, it's more they've contacted people, it's haven't been able to go for an appointment and things like that, more so than actually been able to contact them. They seem to have had the contact, but it's not actually been able to go for appointments and things like that. So generally people have said they've found it, we've been as obviously conscious of trying to say to people, we're still here, we're still around, you can still come to us. I generally found out people that I've spoken to have been aware that they've, places have still been accessible. Which has been good. So
I think we had there was some issues came up at Jordan lockdown around it was hearing aid batteries, on how they were being sent out and trying to contact the services, because I think things changed around that, but that seems to have quietened down a little bit.
Again, we were conscious of doing that. I was conscious of that. As soon as it happened, I said, right, what are we going to do about hearing aid batteries? Again, we're a centre here, and we've got a supply of hearing aid batteries. So I was saying to people, if you need them, we were going out and posting them through the door and things like that. So again, it was talking to people like yourselves. We're fully conscious that we need to make people aware that we're here. So we have got that service. Obviously, most hospitals, but again, just an example, we managed to get a lady. She was at the hospital. Husband was at Halton Hospital for his hearing aids, and of course, he ended up with ill health. He was in a wheelchair, and she was really struggling to get him over to get his hearing aid looked at and things like that. So we actually managed to. She said, I didn't know what I could change, so we managed to contacted the GP, contacted Specsavers for her, and we managed to transfer her husband over to Specsavers for his hearing aid, so she could just wheel him into the town and get his hearing aid sorted without all the hassle. So even just things like that for information, that's why we need this, to make sure that people are aware that those sort of things can happen. And say hearing aids, we're here. So again, if you let people know, once now we can let people sort of come to the centre again. Say if they're travelling over to the hospitals, they can just pop in when they're doing the shopping in Widnes and pop in and get some hearing aid batteries as well.
I've just we've got the information. It's Deaf Awareness Week, isn't it, this week?
It is, yes.
And I'm sure Jude will be sending stuff out on social media, but if you've got anything you want us to promote during the week, just let us know. And
brilliant, that would be great.
We can do that. Has anyone else got any more questions at all? I can see it was Louise put her hand up then.
Yeah, sorry Wendy, I just wanted to, and I know it's difficult at the moment because we're all going back to the unknown and we don't know kind of what it's going to look like compared to how it was. You mentioned about support groups previously, and what do you normally do in the support groups? Is it kind of a group session, or how does that work?
I took over this role. I've done this role for 20 odd years, but here I took it over literally just before the lockdown. So I'd started up support groups. It's basically, my idea was to say to people, it's your group. So I was sort of going with person-led. I wanted to say, we're going to have a group, but it's not my group, it's your group. So how do you want it to look? What do you want to get from it? What do you want to do? And it was like this, basically, people said, we just want to be with people, you know, people. So I managed to get a room at the Norton Fields in the lounge there. And we had about started off 4 or 5 people, and they just came along. I gave them information that they maybe didn't know about, generally had a chat. They were giving each other tips on how they managed, especially in a group. It's when you're in a big group, people with hearing loss, it can be an absolute nightmare. So they were helping each other. So we literally just started the groups, and it was more or less just, I don't want to say a social group because it sounds like we're just chatting up and tea and biscuits, but that's what they make it. We've found with people, to be fair, just an informal get together, chatting to each other. If I've got any information, obviously I say to them, it's your group, you lead. But if I've got something I feel you need to know about, then I might say, right, this week I'm going to let you know about, you know, changes in appointments at the hospital, something like that. So if I've got anything we need to know, I will input that. Hopefully, maybe as we move on, like you've done, maybe get guest speakers and say, is there anything in particular you want to know? And we'll get some guest speakers along. But that's the idea. It was at once a month. Usually say, I think it was the first Wednesday of the month we had it. So we were doing it once a month for people, just to know they've got that support there. And they all said, oh, it's been invaluable. It was just that it's just a relief to talk to somebody else that knows what I'm going through all the time. So we're looking at the moment for venues. Because obviously I'm conscious that because it is a harder hearing group, the majority of people have got hearing loss. So if the group goes too big, they've got that situation of saying, well, it was great, but now it's too big and I'm having the same problem I always have in a large group. I can't hear what's going on. Which obviously will have loop system and things, but the amount of people now have got a waiting list, it may be that we actually have to extend it and have 2 groups in witness, which is fine and which is great because it means more people are accessing what they need. So ideally now we're looking for venues for to hold those sessions. Yeah, same with the tinnitus group, same idea, once a month. And people have found it invaluable, just talking to, because the tinnitus has been a massive thing through lockdown. Obviously it can be brought on by stress, and a lot more people have been, which is good that they have been contacting us to go into the groups. I mean, one gentleman, just a quick example, because he was at work and he couldn't come to the groups, but he said, I've actually spoken about my tinnitus for the very first time after speaking to ourselves. And he said, I've discovered that there's 4 other people in my workplace with it, that we never discussed it. We didn't. So he said, we've sort of formed our own little support group, not a support group as such, but just the fact that we talk about it to each other. He said, so he couldn't come to our sessions, but through speaking to us, he found out. And he said, we all said the same, why haven't we spoken about it before? So it's just things like that. Although he hasn't directly come to us, just that information has enabled him to go and go on to that. So that's what we intend to do. Yeah.
Probably from my naivety, I didn't realise that, you know, you could approach yourselves if you had tinnitus. I didn't know that until this conversation. So it's just all about that knowledge sharing, isn't it?
Exactly, it is, yeah. And I say, even if yourselves don't have it or say, I haven't got it, you'll know somebody who does, or you'll come across in the next 6 months even. I mean, just a bit of a funny story, the example, which can't happen again. When I very first started this, I saw a gentleman and said, how did you find out about us? You know, he said, well, I've got a story. And he said, it was on a cruise in the Caribbean. I said, oh, very nice. And he said, I was, you know, struggling with my hearing and what have you. And he said, I was talking to another gentleman who bizarrely was from Halton. And he said, and I'd had equipment from yourself. And he said, and I told him about your service. And I said, so you've had to go all the way to the Caribbean? And I thought, you know, that's how bizarre it can be, that this poor gentleman was struggling. I met this other gentleman miles and miles away from home, and I thought, that can't be right, can it? You know, we need to be able to make sure we get out more. And so I've actually just been on a call with Halton for the GPs, surgeries, for the practice managers. So I'm hoping that they will pass on as well. So we're starting to get, it's brilliant. So thank you for allowing us to come on, but people are saying, yes, come on and tell us about it. So we've had that call this morning, which I'm hoping will help to make people aware. of us as well. Yeah,
it's wonderful.
So,
I noticed that, as Dave said, that Jude shared in the chat the contact details, but if there's anything that you feel that you can send across to us that we can maybe
the
social
absolutely.
media or anything that would help to publicise, you know, by all means send it
Brilliant.
to send it myself.
If I send it, email it to you, Jude,
absolutely.
Louise, will that be okay? Fabulous. Yeah, that would be great.
I'm sorry, Dave, I didn't notice you.
Oh, I can see Diane's got a hand up. Another question, Diane?
Yes, sorry, it's me again.
It's okay. It's okay.
Another thing, I've got a friend. She doesn't actually live in Widnes. She lives in Warrington,
Right.
but she is deaf and she wears hearing aids. And she said, for the time she's got the hearing aids in, then she puts her glasses on. Then when she has to put a mask on, the hearing aids are just popping.
Yeah.
Is there any miracle thing you can advise over there?
Oh,
she said, puts the mask on and the hearing aids pop out.
I know. I wish there was. I wish I had that magic wand, but I know it. I mean, a couple of people actually lost the hearing aids because of that, pulling it on and off and things like that. Not really. It is a hard one, and with the glasses and things, it is, and we know it's difficult. And they are fiddly, you know. Hearing aids aren't, you know, especially if people are coming to them in later life, and that they are tiny, small things. But
she managed with the glasses. It was the mask that was knocking, and she's dropped them and had to pick them up off the floor several times.
Yeah, I know. I wish. I have. I mean, hopefully, you know, when we get these groups going, I'm hoping somebody might come up with them, and we will definitely share it. If we come across somebody who's got some brilliant idea, then we will definitely share it to let everybody know.
Thank you.
So,
thank you.
Yeah. Okay.
I can't see any more hands up anymore.
Could I ask a question, please? Sorry, I've got no way to raise my hand. Hi, sorry, I've not got my camera on, Wendy. My Wi-Fi just can't cope with any more this morning. Sorry.
Oh, okay, Jude, okay.
Just to say, I've shared your poster this morning, your Halton Sensory one with all the information, and I've put the number in the emails in the chat for everyone and for the Deafness Resource Centre. So everyone's got the numbers and the emails. I just wanted to ask, do you find that the hospital trusts refer people to yourselves very much? Maybe they're new to hearing aids, or they've got a child that might need support.
A hospital trust, you mean hospitals individually or a particular?
Yeah, just like Wiston or Warrington Hospital.
Yeah, we have, again, a few. I mean, we've started to get a good rapport with, I mean, especially at Warrington, the audiologist at Warrington, she was actually the lady that sorted out the hearing aid batteries and things for us. So yeah, we are starting to get things through from the hospitals, which is great. But again, we were getting to the point where we wanted to go and do this with the teams at the hospitals, and of course COVID came along. So this is great. As we're asking people to come on calls, it's really encouraging that most people are saying, yeah, definitely come on and let us know, have the information. But we have done, yes, and brilliantly, we have in the lockdown had a couple of GP surgeries, which is a massive breakthrough, because we were really struggling for them to come on board and see. I don't know why, but we did. But we've, and I say we've had the call today with the GP surgeries, so we're hopeful that things will start improving. That, you know, that's, I said to the GPs and the hospitals, you know, people are coming to you for an appointment that you can't actually help them with. You know, you can't change the hearing once they've got the hearing aid. But we can, and they're not wasting an appointment, but they're taking up an appointment, you know, that you could be seeing somebody else that you can help, when ideally, if they could come straight to us, we could have been straight in there and got an appointment and helped them. So yes, thankfully we are. But anyway, again, sharing information, Judy, is brilliant. If, you know, as many people as we can.
It's just so important. I think, especially if people are new to them, then you can give them that help, can't you? That practical help and support. Because we go to the patient experience meetings for both Warrington and Wiston hospitals, so we could raise it, you know, to make sure, you know, to try and remind them to signpost people to you if they do get given a new hearing aid, or they've got a child who needs that help. We could remind them.
Yeah, because we have, as I say, sometimes it's just about people have got, you know, and knowing about the loop system. Knowing about the loop system. And we're not saying, you know, I don't want to say the audiologists aren't telling them about it, but especially you've got a brand new aid, it's all new, it's all a bit stressful. So they may have mentioned the loop, but it's something that they mention in passing. So people go home, they're trying to get used to the hearing aids, and then they sort of forget about the loop system. And then, and again, another example, a lady years ago, she had went to a granddaughter's wedding and said, "A beautiful wedding, couldn't hear a word, no idea what was going on." So we said, "Did you put your loop on?" She said, "What's that?" So I explained to her.
Yeah.
She came back a few months later, quite cross, rightly so. And she said, "Well, I'm cross in one way, but I'm really," she said, "I found out," she said, "I went back to the same church. Sadly, it wasn't for a wedding, it was a funeral this time." She said, "I found out I actually only had to press that button and I had the loop on my hearing aid and should have heard every word. But should I actually had that facility on my hearing aid at the time, but because I didn't know, no one had informed me what it was and how to work it," she said, I missed out completely. So we've had that so many times. People have actually got that facility, just not knowing.
And nobody's explained. It's such a shame, isn't it?
So that would be amazing, Julia, if it's just that, people saying to them, if you can't help, we're not, and we know everyone's busy and the GPs are busy, but we're saying you don't have to. All you have to do is, here's a number. You know, that's all.
If they could just pass your leaflet, that would be brilliant, wouldn't it? Because I know when we used to go out and about, we used to sometimes, stand in the GP surgeries, and I've met people in the past who needed your support, and I've told them about you, and they've not heard about it. So obviously it wasn't being brought up at appointments, but all they need to do is pass your number. We don't need to be the experts. Just send them to you.
We're not asking you to do a talk like this and tell them all about it. It's just, and same with the vision, people have struggled with, the vision and especially in this, they're isolated at home, they can't even read the mail, and there's a little team here of ladies that can go out and give them that support. So that would be amazing if I'm quite encouraged. I am quite hopeful that the amount of response we've had since all this from like yourselves and the GPs, that people are starting to say, let's have the information and we will pass it on. So that's really good news, because I say it's all about the people, isn't it? It's those people out there. I mean, that's what we're here for. Like I say, it's not about us, it's about them. And if they don't know about it, then they're missing out and they're struggling, a lot. And it's amazing, it is that wow factor, which people say, well, it can't, literally a piece of equipment, and it does, they say it's changed my life, and it sounds quite dramatic. But I've seen it with my, you see that beam come on the face and you think, yes, it's working, and it's nothing better than knowing.
It would. I mean, if you couldn't follow what people were saying, it must be awful. So it would be life-changing. Yeah, absolutely.
Yeah, exactly.
And do you do any deaf awareness courses for people like ourselves who might be chatting to people and we need to do it in a different way?
Yeah, we do. I mean, obviously that's from, Halton Century, that's for the Deafness Resource side. That would be, you mentioned you have the St Helens number. So that would be through our ladies at St Helens. If you rang up and said, we were looking at some deaf awareness training, you contact Deafness Resource direct and ask them, let them know what you were looking for, sort of how many people, and they would be able to give you that information. Again, sign language courses, that's all done at Deafness Resource as well. And they just started stage 1 course of British Sign Language and things like that. So, as I've said, anything at all, even if it's not in what we've mentioned anything of today, anything to do with hearing loss, vision loss, just contact us and say, I'm not sure if this applies, but very often there might be something that's already in place that we can let you know about or put you in touch with. Yeah.
Oh, that's brilliant. Thank you.
Yeah. Oh, you're welcome.
Thank you very much.
It's okay.
Anybody else? Final takers before we let Wendy? Well, I'm going to say enjoy the sunshine out there.
We wish. I know, we wish. Yeah.
No, I'd just like to echo what everybody else has said. It's amazing what new information you can pick up, even though you think you know quite a lot going on.
Exactly.
As has also been said, if there's anything we can do to help in promoting anything you've got, just make sure you let us know. And I'm sure when we all get back out and in the past, we've run sessions where we've been in the market, we've had Deafness Resource with us. So there'd be a chance. Hopefully in the summer when things start to clear up a little bit. Maybe.
Yeah, let's hope so. Yeah.
if there's nothing else, I might let Louise have the final word and say what the next session's on, just so everybody can get it in their diary.
Yeah, we've just, the next session is it's a new counselling service that's set up in Halton, which is going to be free to people. And we've got Jo Pitt coming along. She's the CEO, so she's going to come along and give us a little bit of a talk about it. And that's in conjunction with the mental health week that's coming up. So all I can say is thank you, Wendy. I've thoroughly,
you're very welcome.
enjoyed your talk.
Oh, good.
I've learned so much, but as I say, there's things that I can pass on and we can signpost as well. So
yeah, absolutely. That's what it's all about, isn't it? Things like this, and for you, passing on information and getting information. Yeah, no, definitely. So.
But we are trying to arrange, when you mentioned the Health Hub, we are trying to arrange another session with Carl Mackey about the Halton Health Hub. So I'll keep you included in that, and I'll obviously.
Perfect. That would be amazing. That would be lovely. Thank you, Louise. Yeah. So lovely to meet you all. Anyway, thank you. Thank you for your time.
Thank you.
Right. Okay.